The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanek. Today's title and topic is Dental Medical Integration and TMD. Dental and medical integration. Now, this is the second time I've kind of taken a slice at this topic, but I want to add some additional information and talk about it a little deeper. Maybe you may not even be aware that there is a move afoot to increase, enhance, and develop dental and medical integration. That is, dental services and medical services to integrate their services for the benefit of the patient and actually the benefit of the practices. This is relatively new. The best example of this is Peter Thorne, who is the CEO of Pacific Dental Health, which it is called now. It is the second largest DSO in the country, which I believe has around 900 or 1,000 dental offices, Pacific Dental, primarily in the western half of the United States. But Peter Thorne, who is not a dentist, but started Pacific Dental with two dental practices that were owned by his father, has a movement going to integrate dentistry along with immediate care clinics, and has a growing number of physical locations where the dental office, Pacific Dental DSO office, is in the same physical office as a convenient care clinic, which I think is a wonderful idea for many reasons. The first one off the top of my head is that 70%, this is a fact, well-known fact, the 70% of patients who enter a convenient care clinic have complaints of pain or dysfunction somewhere around the head and neck, oral cavity, face, jaws, head and neck. And of course, a good percentage, of which I can't comment on what percentage of those patients that seek service at a convenient care clinic are actually more appropriately seen by the dentist. But it makes perfect sense why Stephen Thorne would want to integrate the locations of some of his dental offices with convenient care clinics, and now has named his organization, his corporation, his company, Pacific Health. Pacific Health. So kudos to Stephen Thorne, and he is not the only one who is making motion to do this. As I understand it, I did a little research that the University of Wisconsin is actually integrating programs for both the dentist and the MD physician students, dental students, medical students, so that they have portions of their clinical training together where the dentist can integrate their knowledge with the medical students, and the medical students can integrate their knowledge with the dental students, and have certain dates and times where these programs are set up for dental students and medical students to integrate, which I think is an excellent idea. while I was a senior when I was a senior medical student at Vanderbilt in the mid 70s, the dean of the medical school invited me to lecture my medical class on aspects of dentistry. Unfortunately, I only had 1 hour of time, but he offered to do it, and I certainly jumped at the chance. I don't remember exactly how I addressed it. I knew that I wasn't going to be able to do much of a job in an hour trying to enlighten my medical student colleagues, fellow medical students, on what dentistry is all about. But I did, and they appreciated it. And at least that was a good effort by the dean of the medical school, and I appreciated it sincerely. I hope some of my fellow medical students might still remember that lecture I gave them. In any case, there is a movement. There is a movement to integrate medicine and dentistry. And I think it's very, very appropriate to do this. And I want to make the case that TMD is the ideal topic, which actually makes the case for the importance of integrating dentistry and medicine. But before I do that, I want to comment on a recent article that came across my path out of Dental Economics, May of 2024, Dental Economics, just a few months ago, called Bridging the Gap. It was written by one of my oral and maxillofacial surgery colleagues out of New Jersey, Dr. Jason Auerbach. I've met Dr. Auerbach. He is the CEO and chairman of a dental service organization that I believe, I'm guessing, but probably has now 8 or 10 or a dozen oral and maxillofacial surgery practices scattered throughout mid-New Jersey and growing, where he has elected to focus not only the practices, but the integration of medicine and dentistry within the oral surgery practices. Certainly, it makes perfect sense that an oral maxillofacial surgery practice is much closer to integrating itself with our medical doctor colleagues, because roughly nowadays, 50% of the dentist going through an oral maxillofacial surgery training program finish up also with a degree in medicine, medical degree, and a internship in surgery, and then go finish up their training in the higher end of oral or maxillofacial surgery before they come out into practice or academics. But I maintained, and I make the case, that this integration should definitely not just be limited to oral and maxillofacial surgeons. It should also definitely be developed and developed significantly to include our other specialists in dentistry, and especially general dentists. I believe thoroughly that the general dentist should take his rightful place as the, quote, physician of the oral cavity and associated structures. Although he is not a maxillofacial surgeon, and doesn't maintain the surgical skills of facial reconstruction that a maxillofacial surgeon would, he is the closest thing to the patient when it comes to patients seeking advice and treatment for various kinds of pain, dysfunction, and pathology within and around the oral cavity. Now, of course, the oral cavity is just the opening and the first part of the gastrointestinal tract. It is a continuous gastrointestinal tract. And I always wondered why the dentist seemed to be given his area of expertise so totally away from and distracted from medicine, because the oral cavity, the teeth, the jaws, the periodontium, the tongue, all the tissues associated with the associated structures, salivary glands, nerves, lymphatic system are just an integrated part of the rest of the body and the rest of the gastrointestinal system. And why it's held apart, I believe, is only historical. It is only a historical feature. You know, the medical establishment began as bloodletters in the Middle Ages, and the dental establishment began as extraction individuals, people who extract teeth in the later 14th, 15th century, associated with barber poles. Barber pole was initially a barber pole with red lines on it, indicating that there was dental services available, tooth extractions. If you needed a tooth extraction, you went to the barber pole. So, you know, and over the centuries, there was a definite distinction between the dentist and the physician, which I don't think was necessarily appropriate. And it's time to bring this back together. It's time to bring the two professions not identical and not necessarily even equal, but integrated so that the knowledge can be made useful to both, and that the knowledge available is communicated both ways, which is the second point I want to make, and that is the article written by Jason Auerbach, which I'd recommend that you read. He had 5 points on it, 5 points that he made to encourage and develop the idea of integration. First of all, attention to detail of the dentist on the patient themselves and the medical aspect of the patient sitting in his chair. Secondly, the diverse expertise and unified care that would be available if the dentist would pay particular attention to more about the patient's medical history, the patient's symptoms, the patient's comments, and that use his knowledge of the basic sciences and medicine trained in dental school to unify the patient's care, both in dentistry and in medicine, and unify it with the medical teams. The third is the innovation of the integration, and that is to be very innovative, have the opportunity to be innovative on being able to explain some of the symptoms that the medical doctors would not necessarily understand or be privy to, that we see as dentists and quite often take for granted. Fourth, developing a team effort that is not just the dentist, but the team players within the practice to be able to pay attention to their patients as they treat them, the assistants, the hygienists, as they treat them in their areas of the practice, be more attuned to the patient's medical problems, complaints, symptoms. And then fifth, being able to participate with their medical peers on an equal footing, and share information. So it's basically, without reading the article, I just gave you the nuts and bolts of it. But his article was completely designed into describing how the dentist, oral surgeon, general dentist, dental specialist can pursue communication with and for the benefit of the medical establishment, the medical doctor. I maintain that this communication line goes both ways, and it presents a tremendous opportunity for putting in the communication line, and then inviting the medical doctors that the communications line with, is giving them the opportunity to learn more about the dental aspects, quote, dental aspects, oral cavity aspects, first part of the alimentary canal aspects that we as dentists take for granted, that the physician, let's just say a PCP. I mean, if a patient comes in with a sore throat, as talked about for centuries, he looks past the mouth with a tongue blade into the back of the mouth, looking into the posterior pharynx, doesn't even have any idea what he just looked through. The classification of the jaws, whether there's any periodontal disease, if there is, what that means to the patient having chronic inflammation at the first part of his oral cavity, and the impact of that chronic inflammation on the general health and well-being, on the immune system, on the suppression of the immune system in general. And the medical doctor just looks right past that all, which is unfortunate, because he then would have an opportunity, seeing some of these things that we dentists look and take for granted and see immediately, as to referring that patient or educating that patient or helping that patient understand why it's important to treat these things that the average PCP would just look past and totally ignore and not see.